Hi, my name is Dutrochet Djoko. I usually go by Djoko, and welcome back to Pharmacy Talks with D. Uh, we have been talking about the opioid crisis that is currently ravaging our country. Last time we spoke about the impact of that crisis on expecting mom and newborns and things like that. And I've always wanted to talk about this from the pharmacist perspective. You know, someone who is on the field, who is the expert in medication. So today we're going to continue our conversation, and we are fortunate to have with us today a fellow pharmacist, Dr. Valery Kounga. Welcome, Dr. Kounga, and thank you for joining us on the set today.
Oh, thank you very much. Thank you for having me here, D. I gotta say to the audience, the work that you do here in the Denver's community, it's incredible, and thank you for creating awareness in this crisis that we have in the country concerning opioids.
Thank you very much. I feel flattered. So today, now, I wanted us to talk from pharmacist to pharmacist about this crisis and some of the things that we see on a day-to-day life. I've been getting some questions from the audience as to, we always talk about the statistics and how bad these opioids are. I want to start by defining, when we talk about the opioids, right? What is it that we're talking about? What are some of the medications that we're referring to?
So opioids are pretty much a class of drugs that are morphine based and mostly used to treat pain. In terms of those opioid drugs, we're talking about oxycodone, Percocet,
Yeah, Vicodin,
yes, morphine,
morphine, yes.
the hydromorphone,
Yeah, fentanyl. Is
fentanyl.
one of
That's a
them
good
as well.
one.
Yes, yes.
So,
So in today's conversation, who do you think can benefit to some of the? Because I know we have always talked about prevention and some of the things that people can do at home to keep themselves and their family and their friends safe. So what target audience do you think can benefit to our conversation today?
I'll say, our target audience is really patients that feel opioid routinely. Also, patients that are feeling opioids for the first time. And, it can also be healthcare providers that, either write or dispense opioids.
Yes, yes, because and I think that's a great thing because it's easy to always talk about some of the bad things that these opioids can do to society and to the people, but it's also important to remember that, in my opinion, these are very good medications.
Yeah,
And when used
absolutely.
the right way, they can be very good and powerful and helpful. So we want to not forget about the people who actually need these medications and who want to do the right thing. And I think that's where we're going to focus today, if that's okay with you. We want us to try to talk to the people who need it, they're using it for legitimate purposes, and they hear about like how bad it is and how dangerous it is, and they're starting to get worried and say, wait a second, yeah, I know I have cancer, but they're telling me that this thing is bad. What am I supposed to do, right? So,
Exactly.
so just clarifying that these are not bad medications, you just have to use them the right way.
Right, that's right.
And now, what aspect of it do you think we should focus on? Like some of the objective that.
Yes, absolutely. So, being a retail pharmacist, I come across a lot of questions, patients having a lot of questions around their prescription medication for opioids. So today I'm hoping to sort of cover some of those confusions, mostly around, the day supply, early fills, the prescription elements that have to be on an opioid prescription. We can also talk about partial fills, We're also going to talk about border state. Like if you were to bring a prescription from another state, would it be valid in Massachusetts? And finally, we're going to talk about opioid disposal, how to get rid of all your unwanted
Unused
medications.
Okay, very important, because I think that information will be really useful for the people who need these medications and want to use it for a legitimate purpose, which is what we encourage. As pharmacists, we raise the right hand and say do no harm. So we want to make sure that people just do it the right way.
Yeah, absolutely.
Now, speaking of these opioids, I know there's a different classifications of drug by the DEA, right? And the opioids, I believe, are Schedule 2. Now, I know for the audience at home, they'll probably say, what is Schedule? Could you elaborate on that a little bit as far as the classification?
Yes, absolutely. So the Drug Enforcement Agency, which is also known as DEA, has classified all of this variety of drugs in 5 schedules. So the first schedule, Schedule 1 medication, or Schedule 1 controlled substances, are really those that are still illegal. We're talking about cocaine, LSD, heroin.
Yeah.
So those are really medications that, patients should not have. And, if you were to get, if the, you can easily get arrested or, go to jail, have jail time if you possess those type of drugs. The second thing is Schedule 2 controlled substances. Those are, drugs that have a really high potential of abuse and can lead to very serious physical and psychological dependence. We're talking about, like we mentioned earlier, your morphine, your Percocet, your oxycodone. We also have some stimulants like Adderall, methylphenidate. So those are Schedule 2 controlled substances.
I'm sorry for interrupting you, but the potential for abuse doesn't mean that you're automatically going to be dependent on them. As long as you take it the right way and you monitor by your provider, you most likely will be fine. Is that a clear
That's
assumption?
Absolutely correct.
Okay.
It's important to mention that, like you mentioned earlier, these drugs are not bad drugs. You just have to use it for the right reason.
Exactly. Okay. And then after the Schedule 3.
Yes, so after we, falling down in Schedule 3, which are really drugs that kind of have a moderate potential of abuse, and we really talking about your Tylenol with codeine or, your regular anabolic steroid like, testosterone.
And things like that. So those have they also have a potential,
Yep.
but a little lower than the Schedule 2.
Schedule 2.
So that means you also have to make sure you use it the right way because the potential is there.
Right.
And then the next one will be Schedule
And then we're
4.
falling down to Schedule 4, lower potential of abuse than Schedule 3. And on Schedule 4, we're looking at your alprazolam, your clonazepam, your temazepam, your Ambien.
The benzos, yes.
Yes, so all those benzodiazepine.
Okay. And the next one will be the Schedule 5.
Yes, so the Schedule 5, even a lower potential of abuse than Schedule 4. And we're looking at the cough medication with codeine.
Okay. So those will be. So now that's the classification that the DEA has as far as those schedules are concerned. Now the focus of the opioid crisis and the focus of today's law and regulations and things that people should know at home and do, to continue to protect themselves and their family, we'll be focusing on the Schedule 2 opioids, which is your Percocet, your Vicodin, your hydromorphone, your OxyContin, oxycodone, morphine, fentanyl. That's what we'll be focusing on. Now, can you get, how many days supply of those schedules can you get at once?
Yes, so it's important to mention that in the state of Massachusetts, when your doctor gives you a prescription for a Schedule 2 controlled substance, the maximum day supply, it's 30 days. So 30-day supply is the maximum. I've had patients that had received prescription opioids for more than 30 days unfortunately, I had to let them know I cannot fill it for more than 30 days, so they will have to lose the rest of the prescription. But however, there are some exceptions. When we're talking about opioid naive patients, meaning patients that have only had opioids, and that are having opioids for the first time. There's a limitation to only a 7-day supply.
Okay.
So the maximum that we could do for those patients is
Will be
7 days.
for the first time.
For the first
that
time they're
getting it.
filling it.
Okay.
Yep. The second thing will be for teenagers. Teenagers, you really want to give them only 7 days, and that will be with parental consent. So the parents will have to approve that the pharmacist can dispense, 7-day supply, maximum of 7-day supply to their child.
Okay. Okay. And so now, if I have a situation where, I understand the 30 days, because remember, we want to address concerns that we're getting from viewers about getting their prescriptions, for whatever they need, right? Because you have this person who has got, I guess, cancer or something else, who need the pain medicine, and they need it for more than 30 days. But maybe the doctor is going to go on vacation, or maybe, they can't drive into Boston in 30 days to get it because they have no means of transportation, because they're homesick, they're alone. Are there things that patients can do in that case to alleviate the situation?
Yes, absolutely. We have the ability, a patient can receive multiple prescription for C2 controlled substance, given that it's a maximum of 30 days. So since each prescription is a maximum of 90 days, I'm sorry. Since each prescription is 30 days, what the doctor will have to do is will have to write a do not fill date on that particular on the prescriptions.
Okay.
And so therefore, when the patient comes in for their next filled, the date that the prescription was issued will be the date, the do not fill date that the doctor put on the
So if the patient is going on vacation or can't make it back to the office and need the medication for legitimate purposes, we don't want to we don't want to only focus on the people who are abusing, right? We want to also take care of the people who actually need the medication. So the doctor can actually give them multiple prescriptions, up to 3, and just put on do not fill date. So now they will have 3 months worth at home, but not at once. So they'll fill the first one, and then after the do not fill date, so they can ask their doctor to give them that prescription for the following month, and they can bring that to the pharmacy, and the pharmacist will honor that as well.
Absolutely.
And the pharmacy, sometimes also the problem we have, which can delay the treatment for a patient that needs, is the information that's on the prescription. So as a patient, and when I get my prescription from the doctor, what are some of the things that I should look at? I'm sure we're professional, right? We're healthcare professional, and the doctor knows what. But sometimes you get busy and you write really fast. And what are some of the things that patients can do when they get that prescription to make sure that they have a legitimate prescription with all the information needed to be able to prevent any further delay from the pharmacy?
Absolutely. So some of the elements that are required on the prescription for C2 medications will be the full patient name, that means last name, first name, and the full patient address. Now the date of birth, it's not a requirement, but however, when you come in the pharmacy, we'll ask you for your date of birth just to put that on the prescription. We also obviously need the prescriber full first name and last name, as well as the prescriber DEA number and the prescriber full address also.
Okay.
The other thing that we need obviously will be the drug name, the strength, the dosage, the direction of use, and really any cautionary statement that the prescriber feel or deem to be important to know.
Yeah. So it's important that if you get your prescription, you take a look and make sure that all those informations are present before you walk out of the doctor office and get to the pharmacy, and unfortunately cause more delay because I mean, I'm sure there have been instances where people came in and the name on there was actually, I mean, not their name because, you know, it could happen. So by taking that 30 seconds, just looking at it, it's true you may not understand some of the instructions because they're usually written in SIC codes. That's how we refer to them. But at least the information that you can understand is, you know, what your name is, your date of birth, you know, what the medication is, and the quantity, and the doctor's information. So I think that's really important. Now, there's also, just for people at home who need this, there's been a new law also on the partial fill, you know, that they enacted. Do you want to elaborate on that a little bit for the viewers?
Yes, absolutely. So it's a new law in the state of Massachusetts where for every controlled, you know, Schedule 2 controlled substance, especially opioids, the doctor has to mark on the prescription, you know, patient may request a partial fill. However, it's important for patients to know that when you require, you know, when you ask the pharmacist to fill it for a quantity lesser than what the doctor prescribed, it's important to know that you will lose the rest of that prescription. So I know that I've had a lot of confusion with patients because they thought they could come back and get the rest of the medication, but unfortunately it's not the case. But it will be the duty for the pharmacist to reach out to the patient prescriber and let them know that their patient only filled
part of the prescription. They didn't fill the whole thing.
Yes.
So if you get, I mean, and this is good to know because sometimes people might think, oh, if the doctor is giving me 90 tablets, I have to get the 90 tablets, even though I feel like I may only need it for 3 days after my root canal. Right. So it's okay to say now to your pharmacist when you go out there, you have a child who just had a tooth pull or whatever the reason is. So you know what, give me less than, you know, I just need maybe 10 tablets. And if you need more, there's always that possibility of reaching out to the doctor and getting a new prescription. We just don't want people to have this hanging around the house or continue to use it if the pain has subsided. That is why they enacted the law to reduce and give patients the ability to request less than what the prescription calls for. So it's important to know that that's a decision you can actually make as a patient. And now, if somebody is, because I get this question all the time too, for out-of-state prescriptions, you know, because some people, they may just have moved into the state or, you know, they were traveling and they got injured somewhere else and then they get a prescription and they're flying back. Can you elaborate a little bit on the out-of-state prescriptions? Is it, if I get a prescription in New Hampshire, can I fill it in Massachusetts? Because remember, we're trying to help the people who actually need this stuff to prevent delay of care.
Oh, yes, absolutely. So for out-of-state prescriptions, you know, it's a law that was enacted in December 1st of 2013, where in the state of Massachusetts, they call it border states. So there's about 5 states where, you know, if you bring a prescription for an opioid from those states, you'll be able to be, it will be a valid prescription in Massachusetts as well, given that it was written by a physician only, so not a nurse practitioner.
That's important, yes, because
that's very important.
Nurse practitioners can actually write these opioids. But if you're out of state, you want to make sure that the physician is the one who gives you that prescription.
Yes, that's right.
Very important.
And in terms of the state, we're really talking about, you know, Vermont, we're talking about New Hampshire, like you mentioned. We have New York, we have Connecticut, we have Rhode Island, and also we have Maine. So those are really the states that, you know, once you receive a prescription for opioids, you can, you know, you can fill it in the state of Massachusetts. Again, given that it was written by a physician, and also, you know, it's like a 5-day limit. So you want to make sure that from the date that prescription was written to the date you fill it, it has to be within 5 days.
Okay, so if you get a prescription in New Hampshire, you got 5 days to get it filled in Massachusetts if it's a
Right.
prescription for opioids, which is like the Percocet, the OxyContin, the oxycodone. Past the 5 days, the prescription has expired.
That's right.
But if that prescription was written from a Massachusetts doctor, you have up to 30
Up to
days.
30 days,
So
that's
you
right.
can you can have the prescription for 30 days if it's written from a Massachusetts prescriber. And if it's a Massachusetts prescriber, the nurse practitioner can actually write the prescription, right? It
That's
doesn't
right.
have to be the doctor. And so if you're coming from, I don't know, Pennsylvania or Florida, and you have a prescription for opioids, unfortunately, you'll be out of luck. That's some of the things that they put in place to prevent, like, what do they call it, meal pills or something
The
like
pill
that?
mills,
Pill
yes.
mills, yeah, that's the name. Thank you. Yeah, to prevent pill mills, which were like these doctors that were just unfortunately ruining it for everybody else, giving prescriptions which were not necessarily legitimate. No, this is really good information for people to know at home and understand. Like I said before, it's very important. These are good medications. You just have to use them the right way. Now, the final point I want to talk about is the disposal, right? So if you get your prescription and you don't need it anymore, how there are ways to get rid of it. And do I just bring it back to the pharmacy? People ask me that all the time. Do you want to elaborate on that a little bit?
Yes, absolutely. It's important to know that, to know about opioid disposal or medication disposal in general. There's some small steps that you can do at home to get rid of your unwanted medications. So what you could do is to really, first of all, you have to keep the medication in the original container. And now you can add up some water or some soda inside the container to kind of dissolve the medication, and it's going to help to really disguise that medication. And after that, you can put it into, you can add up some coffee ground or cat litter inside the container, just to prevent it from being eatable by a human. And then after you've done that, you really can just seal the container and then put some tape around it and hide it in your trash. And please do not put it in your recycle bin.
Okay, that's good to know. Now, I was talking with and in Denver, we're actually very fortunate. I even have an easier process than that for people. Well, guess what, folks? In Denver, we have a drop box at the police station. So that is what we actually used to do. And I mean, if you can't get there, obviously, you can get rid of it a different way instead of just leaving it at home.
Right.
But if you can, it's very easy. All you do is walk down to the police station. The drop box is right at the entrance. No question asked. It's kind of like a mailbox. So you can put things in, but you can't take anything out. So you just walk into the Denver police station and you put it in and you walk out. Nobody will ask you, where did you get it from? Where is this coming from? Because having those at home, I always say you might think, oh, maybe I'm going to need it for the next surgery, or maybe I'm going to need it for the next root canal. If you have that medication in your closet for 6 months, 1 year, 2 years, I've seen patients bring me bottles from 15 years back and asking, oh, is it still good? Well, if you haven't used it for that long, you probably don't need it. And you don't want to have a situation where you might have kids. And people say, yeah, I don't have any kids at home. But you never know, right? You might have a visitor and you might end up feeding somebody addiction because of some medicine that you had at home that was unused. So it's important to get rid of unused medication and just get rid of it the right way. I remember back in the days, they used to say, you can flush it down the toilet, right? And I always say to myself, well, I tell my students sometimes, you flush your medicine down the toilet, where does the sewage go, right?
Right.
It goes in the ocean. Now you're adding more pollution. and you don't want to eat your salmon high on Percocet, right? You're having a dinner with your salmon on the table that is high on Percocet. We don't want that.
Right,
So
absolutely.
we definitely want to get rid of it the right way, and make sure that we don't leave it out for either animals or people to put their hands on. Well,
Absolutely.
Dr. Kounga, I can't thank you enough for this information. It's important, and it was important for me to try to reassure people that it's okay to use these medications. You just have to use it the right way. And there are some guidelines and law and policies that we kind of paraphrase from the state of Massachusetts and the federal government as well, to help people take control of their healthcare and try to curb the crisis that we're currently experiencing.
Absolutely.
So I want to thank you very much for stopping by. And for the viewer at home, I thank you for watching. And hopefully this was informative. Hopefully you did get something out of it. And, we will continue our conversation on not only these topics, but different topics from the pharmacist perspective. And thank you for watching, and see you next time. Thank you very much.